this week critical thinking seminar is going to be on the topic of bullying at workplace, civility, and etiquette for nurses by Yaroslav Levinets. Negative behavior in the nursing workplace has been a problem for a very long time. In reality, this practice causes considerable harm to nurses and ultimately their patients. A significant percentage of nurses leave their first job due to inappropriate behaviors of their coworkers. And there are three main types of negative behavior in the workplace, which are bullying, incivility, and harassment. The first type of inappropriate behavior in the workplace is bullying, and it can be defined as a repeated, less favorable treatment of a person by another or others in the workplace, which may be considered unreasonable and inappropriate workplace practice. It includes behavior that intimidates, offends, degrades, or humiliates a worker, possibly in front of coworkers, clients, or customers. And good examples of bullying can be yelling, insulting, and making person do unfair assignments, and a lot more. Incivility is the second type of inappropriate behavior in the workplace. Incivility is one or more rude, discourteous, or disrespectful actions that may or may not have a negative intent behind them. Examples of incivility can be insulting comments, not giving credit when it's due, spreading false rumors, social isolation, and bad manners. The third type of inappropriate behavior in the workplace is harassment. It can be verbal, visual, and physical. Harassment is an unwelcome conduct that is based on race, color, religion, sex, including sexual orientation, gender identity, or pregnancy. Also national origin, older age, disability, or genetic information. Examples of harassment are offensive jokes, slurs, physical assault or threats, name-calling, intimidation, insults or put-downs, and offensive object or pictures. Inappropriate behavior in the workplace negatively affects both healthcare providers and patients. It reduces patient satisfaction, reduces employee productivity, increases medical errors, and decreases quality of care. Bullying in the workplace can be a big problem, especially in the nursing field. The first really important step to be able to avoid bullying is to find best role models for yourself. It may mean seeking out academic programs and job placements that emphasize compassion. Through this exposure, you'll learn not only how to avoid inadequately bullying other nurses, but also how to confront bullies firmly and peacefully. If you already faced bullying, it's very important to stand up to bullies and let them know that their behavior is unacceptable. A lot of times they may not even be able to see that their words or actions are harmful. If you standing up to bully, it's very important to practice healthy conflict resolution. If you're unable to fix the problem by yourself, by talking to bully, it could be a good option to document their behavior and get HR involved. Sometimes it could be the best option. Also, it's very important to know when you should seek for legal resources to fix the conflict. And in the worst case scenario, if you weren't able to fix the conflict, it could be a good idea to look for work somewhere else, for healthier workplace environment. When you work as a professional nurse, people, including your team members and your patients, have very high expectations to you. It's very important to maintain professional etiquette, which goes a long way in ensuring a successful career as a nurse. Etiquette means more than simply having good manners, because it cultivates good relationships. As a nurse, your professionalism is characterized by how you relate to patients in different situations. Another expectation to professional nurse that people have is putting patient first, which means not only to uphold patients' rights, but also to care about how patients feel. Also, professional nurse communicates effectively and collaborates with others. Working as a nurse means acting as part of a team, so it's important to have a collaborative attitude and value to the contributions of others. Professional nurse is going to uphold the standards of care by keeping their knowledge and skills up to date, by delivering advanced-based practice care only. Staying accountable and honest is expected from professional nurses, because nursing is the most trusted profession in the world. It's important for those in nursing profession to maintain their integrity by taking professional responsibility and holding themselves accountable for any mistakes they make. In this interactive part, please watch this video. It has 3 different situations of inappropriate behavior, and imagine that you are victim of each of those situations, and please come up with a solution for each problem. How would you deal with those situations in real life? Thank you everyone for your time. Here are my references, the articles I used, and the video you saw in the previous slide.